Former U.S. President Joe Biden has been diagnosed with advanced prostate cancer. According to a statement from his office, the cancer is aggressive and has already spread to his bones. Let me repeat that, former President Biden is now battling prostate cancer that is not only aggressive but has metastasized, meaning it has spread beyond the prostate, specifically to the bones. This raises serious health concerns. Doctors say President Biden's cancer has been graded as Gleason Score 9, grade group 5. These are among the highest and most aggressive classifications in prostate cancer. This indicates two things. The cancer grows very rapidly. There's a high risk it will spread, which, in Biden's case, has already happened. Most prostate cancers don't show symptoms until they're quite advanced. In Biden's case, the diagnosis came after he began experiencing urinary symptoms, which suggests the disease had already progressed significantly by the time it was detected. The statement from his medical team mentioned the cancer is hormone responsive. That means doctors are hopeful that reducing testosterone, which prostate cancer cells use to grow, could help slow or stop the disease. There are a couple of standard hormone treatments used, Lupron, which stops the body from producing testosterone. Anti-androgens, which block testosterone from binding to cancer cells. In aggressive cases like this, doctors often combine treatments, surgical removal of the prostate, radiation therapy targeted at cancerous areas, hormone therapy to control cancer spread. These may be used together depending on how the patient responds. Prostate cancer is very common. In fact, over 80% of men over age 80 have some prostate cancer cells. However, not all are dangerous or life-threatening. The problem arises when the cancer becomes aggressive and spreads beyond the prostate. In Biden's case, the cancer has reached his bones. When that happens, the 5-year survival rate drops to around 30 to 40%, depending on how well treatment works. Many are questioning how a former president, with access to the best possible medical care, could receive such a late-stage diagnosis. Prostate cancer is often monitored using the PSA test, prostate-specific antigen. But experts warn that this test isn't always perfect. Sometimes PSA levels remain normal even when aggressive cancer is present. Doctors usually track the trend in PSA levels over time, and if there's a rise, they may recommend an MRI and possibly a biopsy. It's unclear from reports whether Biden's PSA was ever abnormal or if something was missed. Doctors will likely begin aggressive treatment right away. Their goals will be reducing cancer activity with hormone therapy, targeting bone lesions with radiation to reduce pain and slow spread, possibly removing the prostate if it helps reduce symptoms like urinary obstruction. One of the side effects of these treatments can be fatigue and general weakness, which will likely impact Biden's day-to-day life. However, many patients with hormone-responsive cancers see improvements in the first few months of treatment. Doctors are expected to monitor how his body responds closely over the next 3 to 6 months. Before we continue, if you're finding this news coverage helpful and informative, please consider subscribing to our channel. It helps us bring you real, clear updates with no noise, just the facts. To summarize once more, former President Joe Biden has been diagnosed with advanced prostate cancer. The cancer is aggressive, Gleason 9, grade group 5, and has already spread to the bones. Doctors are beginning hormone therapy and considering radiation and possibly surgery. The situation is serious, but there is hope if the cancer responds to treatment in the early stages. Prostate cancer is one of the most treatable cancers if caught early. But in this case, it wasn't caught early, and that's what makes this diagnosis so concerning. We will continue to follow this story closely and bring updates as they become available. Stay informed. Stay safe.